Hello everyone. A very good morning to all of you. I hope I'm clearly visible, audible. Am I live? Let me confirm if I'm clearly visible, audible. I will start the lecture ahead. Give me a minute to confirm it. Yeah, I hope it is working. So I welcome you all for today's session. A very good morning and a refreshing morning to all of you. I am Dr. Priyanka Sachdev here, and today I am here to continue my series of super simplified pathology. In this series, I am going to cover the entire pathology from Robbins on YouTube in a super simplified, unique manner. Right? So we have started the series 2 days back. So in this series, I have started from general pathology. I have started teaching you general pathology. After finishing general, I will go with hematology and systemic pathology one by one. So in general pathology, these are the headings or chapters which I am going to cover in this series, super simplified pathology. We have already started the first chapter, cell adaptations and cell injury. So today is the time to study the cell death, that is apoptosis and necrosis, right? So there are three portions in the first chapter or in this topic, that is cell adaptation, cell injury and cell death. We have already covered cell adaptation, cell injury in the last YouTube lectures. Those who have missed, they can watch the recordings. It is available on the YouTube and you can watch the recordings anytime. So let me start with cell death now, right? Let me start. So let me give you the introduction of the three as usual. Can you see this is a cell? Normally all cells in the body are in homeostasis. What do you mean by homeostasis? What do you mean by, so this is a cell of the human body. All the cells of the human body has a specific structure and they perform a specific function. This is known as homeostasis. The cell with a specific structure is performing a specific function. This is known as homeostasis. What do you mean by homeostasis? Just suppose the cells of my salivary gland are doing the function of secretion. The cells of my intestine are doing the function of the absorption. So specific functions, specific cells in the body are assigned specific function by the God. That is, all cells are in homeostasis, right? All cells are in homeostasis. But whenever any stress come on the cell, whether the stress is pathological or physiological, you can see this is a cell, the cell is in homeostasis. But whenever any stress coming to this cell, whether physiological or pathological, physiological stress means pregnancy, menstruation, which is not a disease but which is not a normal state, that is physiological state, physiological stress. So what does the cell will do? Cell will do three things one by one. The first thing cell will do is cell adaptation. Cell will try to do the adaptation by doing various types of adaptation. If the stress persists, the second thing cell will do is reversible cell injury. Reversible cell injury, the cell injury will be there, but it is reversible. Once you remove the stress, the cell will be normal again. If the stress still continues, the last thing cell will do is irreversible cell injury. What is irreversible cell injury? It is nothing else, but it is cell death. That is my topic for teaching today. So it's cell death. So irreversible cell injury and cell death are two synonyms. The meaning of the both is same, right? So can I say the three things are in progressive order? There are five type of cell adaptations: hypertrophy, hyperplasia, atrophy, metaplasia and dysplasia. We have seen the differences between them and we have seen all cell adaptations are reversible. Once you remove the stress, the cell will be normal again. The cell will be normal again. The second is reversible cell injury. Yesterday we have seen the various mechanisms of the cell injury, the five mechanisms of the cell injury, right? Again, as the name indicated, is reversible. Once you remove the stress, cell will be normal again. But if the stress continues, the cell will ultimately die. Now, there are two mechanisms by which cell death can occur: apoptosis and necrosis. So, cell can die by one of the two mechanisms, either apoptosis or necrosis. So, today I will teach you the differences between apoptosis and necrosis. Why there are two mechanisms of cell death, right? What is the difference between them? Does cell have any choice whether the cell want to die by apoptosis or necrosis? Which cell will die by apoptosis? Which cell will die by necrosis? And when do the cell will die? So these all answers will be given in today's lecture. That is an overview. I hope you all got it. You all got it. Should I proceed? So this is the five types of adaptations that we have already covered. I hope the master table is ready with you. So there are three portions we have to cover. Now the first portion, cell adaptations, is already covered by me. So in the last YouTube lecture, I have asked you to fill this master table so you can revise the entire adaptations in 2 minutes. In 2 minutes, you can read the table and revise them. So that is the 5 type of adaptations. I'm not going in detail. We have seen the differences between reversible and irreversible cell injury, the various mechanisms of the cell injury. You can see this is reversible cell injury, this is irreversible. We have already covered it in the last lecture. Let me start with the third topic of today. The main topic is cell death. So today I am going to teach you cell death. Are you people with me? Let me see if I can see your chat, yes or no. Give me a minute to see the chat. Give me a minute to see the chat. Yes, I can see your chat. So I am teaching you cell death right now. Cell death. So there are two types of cell death. What are the two mechanisms of cell death? Apoptosis and necrosis. I'm going to teach you both apoptosis and necrosis one by one. Let me start with apoptosis. Both are cell death. Let me start with apoptosis. So today first I am teaching you apoptosis. Now what is apoptosis in short? If you ask me apoptosis in one word, to define apoptosis in one word, I will define it as cell suicide. I will define it as cell suicide. So cell is committing the suicide. The cell is committing the suicide. Now the question arises, why the cell is committing suicide? No one wants to do the suicide now. Does the cell have any problem? Without problem, no one does the suicide. So why the cell is doing the suicide? So it is literally, in literal terms, the apoptosis is nothing. It is the suicide of the cell. Cell is committing suicide. The cell can have one of the two problems. What are the two problems? Either the DNA of the cell is damaged to such an extent that it cannot be repaired now. So DNA is damaged to such an extent that it is no more repairable. The P53 gene cannot repair the DNA now. So cell will get a signal that please commit the suicide, because the DNA is already damaged. There is no use that you will live, and please commit suicide. So that is the first reason the cell will commit suicide by apoptosis. The second reason, the cell has already performed its function in the body and is of no more use in the body. So the body will give signal to the cell that your function in the body is already over. Now please commit suicide. We don't want you. So cell will commit suicide. So here in both of them, the cell is getting a signal. The cell is getting, here the signal is coming from outside. The body is giving the signal that your function is over. Now please commit suicide. And here the signal is coming from inside. The nucleus of the cell is giving signal to the cell that I am damaged. The DNA inside me is damaged. Please you commit suicide. So signal, the cell is getting signal either from outside, from the body. Imagine this is a cell. Imagine this is a cell. This is the DNA of the cell. This is the nucleus of the cell. Please see the cell. Now here two things can happen. Either the body is giving signal to the cell that your function is over in the body. You are no more required. Your function is over. Please commit suicide. So here signal is external. Here signal is external. Or if the DNA is damaged to such an extent that P53 gene tried to repair it, but it is not repairable. So the DNA, the nucleus will give the signal to the cell that please commit suicide. So here the signal is coming from inside. Give me a thumbs up. Give me a thumbs up. You got it, Sophie? You got it? So there are two types of signal. So that's why there are two pathways in apoptosis. I am going to teach you in this lecture in detail. That is extrinsic mechanism and intrinsic mechanism. I will teach you two mechanisms. In extrinsic mechanism, the cell will get signal from outside. In intrinsic mechanism, the cell will get signal from inside. That is the two type of apoptosis. The mechanisms I am going to teach you in detail. Give me a thumbs up. Come on. Okay. So apoptosis. So definition, in short, the definition is cell suicide. We have seen. I'm going to teach you the topic in these headings. First, I will teach you what is the definition, then what are the type of apoptosis with their example, what is the mechanism, the most important, the two mechanism, the steps in the mechanism, extrinsic mechanism and intrinsic mechanism, where the signal is coming from outside and inside respectively. Then the morphological changes in apoptosis, diagnosis of apoptosis, how you will do the diagnosis, the two ways of diagnosing apoptosis, and in the last but not least, the differences from necrosis. Apoptosis and necrosis are the two type of cell death. Now you should know the differences between them, right? So this is a simple definition. What is the definition given in Robbins? Apoptosis. What is the definition given in Robbins? This is the definition given in Robbins. You say, ma'am, it looks complicated. Okay, let me simplify it. Let me show you a diagram in which I will explain you this entire definition. Then I will come on this page again and read the definition. Don't read the definition now. See this diagram. Can you see a cell? Yes, this is a cell of human body. This is any cell of human body. Now inside all cells of human body, from head to toe, we are made up of cells. So all the cells, they have enzymes in their cytoplasm. The name of the enzyme, there is an enzyme which is known as caspase. It is present in me, you, all of our cells. But the enzyme normally is inactive. This enzyme normally inside all my cell, currently it is inactive. It is inactive. The caspase, there are many types of caspase. Caspase 1, 2, 3, 4. There are lots of caspase. All of them are inactive. They are present in the cytoplasm, but they are inactive. But when this cell receives signals, either from outside or from inside, extrinsic or intrinsic. Whatever signal the cell is receiving for the suicide, if it receives the signal, the caspase will become activated. So all these caspases which are inactive, they will become activated on receiving signal. Signal can come from outside the body if the function of the cell is over. Signal can come from inside, from the nucleus, if the DNA is damaged. So both these signals will activate the caspase. Once the caspase is activated, what does the caspase will do? See, the caspase will degrade three things. Number one, nucleus of the cell. Number two, cytoplasm of the cell. And number three, cell membrane, plasma membrane of the cell. So nucleus is also degraded, cytoplasm is also degraded, and plasma membrane is also degraded. And small portion of all three is packed into multiple bodies. A small portion of plasma membrane, a small portion of cytoplasm, a small portion of nucleus. A small portion of plasma membrane, a small portion of cytoplasm, a small portion of nucleus. Likewise, multiple bodies are created. These are known as apoptotic bodies. So, in short, we are converting the entire cell into multiple apoptotic bodies, and there is no leakage outside. Please mind my words. There is no leakage. During this process, the cytoplasm is not leaked out. There is no defect in the plasma membrane. Plasma membrane do not have gaps. It is intact throughout. The plasma membrane is intact. The only thing, it is converted into multiple bodies. During this process, there is absolutely no leakage outside. No leakage of the cytoplasm. Agar bahar leakage nahi hua, if cytoplasm is not leaking outside, the inflammatory cell will not come. So how they will come to know that something is happening? So there is no inflammation. The biggest difference between apoptosis and necrosis, the two type of cell death. In apoptosis, there is no leakage, no inflammation. But in necrosis, there is leakage, there is inflammation. Give me a thumbs up. Come on, give me a thumbs up. Come on, everyone. So have you got it? So no leakage, no inflammation in apoptosis. With leakage, because in necrosis, the cell will burst. I will teach you necrosis, the next topic. The cell will burst. So all the cytoplasm will leak out. So on bursting, the cytoplasm will leak out, so it will cause inflammation. Give me a thumbs up. And in the end, the last step, a phagocyte will come. Can you see a phagocyte here? A phagocyte, the green color cell. It will come and eat or engulf all the apoptotic bodies and eat all the apoptotic bodies. This cell disappeared from the world. This cell disappeared from the world. It has committed suicide. The cell has committed suicide by activating caspase enzyme. Give me a thumbs up. Come on. Are you people there? Have you got the definition? Now I will read the definition for you. The complicated definition I have simplified for you. So I will read the definition for you. Can you see the definition? Can you see the definition? Yes, you can see the definition. So what is apoptosis? It is a pathway of cell death. It is a pathway of cell death. Of course, it is a type of cell death. It is a pathway of cell death which is induced by tightly regulated intracellular program, in which the cell which is destined to die, a cell which is destined to die, a cell in which we want the cell to die, which is destined to die, that cell will activate certain enzymes inside the cytoplasm. The name of the enzyme is caspase. The name of the enzyme is caspase, and after activating, the caspase will degrade the cell's own nucleus, cell's own cytoplasm, and cell's own plasma membrane. So the entire cell will be converted into apoptotic bodies. In the end, a phagocyte will come and eat or engulf all the apoptotic bodies. In this process, the entire process, there is no leakage, no inflammation. These two negative findings are important in definition. You will see, ma'am, if there is no leakage, no inflammation, why you are mentioning? It is negative. It is not a positive finding. It is a negative finding. It is absent. So why you are mentioning? Because these 2 points differentiate apoptosis from necrosis. So in the definition, it is very important to write that leakage and inflammation are absent in apoptosis. In contrast, which make it different from necrosis. In necrosis, these two are present. Have you got it? Give me a thumbs up. So can I say that apoptosis is a way of eliminating unwanted cells from the body? Those who have already performed their function, they are no more needed in the body. So it is a way of elimination. We ask the cell to commit suicide. You are no more needed in this world. Please commit suicide. Number one, or those cells which are damaged beyond the repair. The DNA of the cell is damaged beyond the repair. So we also ask them to commit suicide. So that is the 2 reasons why the cell is committing suicide. Why the cell is committing suicide? If anyone is committing suicide, the person may be in problem, na? Otherwise, a happy person is not committing the suicide. What is the problem to this cell? The cell is committing the suicide, na? The cell is having one of the 2 problems. Either the function in this world is over and cell is no more needed, or the DNA of the cell is damaged too much and it cannot be repaired. So that is the thing. Give me a thumbs up if you got it. Give me a thumbs up if you got it. Now, the first difference from necrosis, there is no leakage, no inflammation. In necrosis, there is leakage, there is inflammation. We have already got it. The third difference is that apoptosis occurs of a single cell, not a group of cell, not a group of cell. Necrosis occurs of a group of cell. So till now, we have seen the 3 differences between apoptosis and necrosis. apoptosis and necrosis. We have seen the three differences. What are the three differences? Can anyone tell me? In apoptosis, there is no leakage of cytoplasm outside. That's why there is no inflammation. That's why there is no inflammation. Have you got it? There is no inflammation. There is no inflammation, right? Since the plasma membrane is intact, since the plasma membrane here is intact till end, that's why there is no leakage. But in necrosis, the plasma membrane is not intact. Plasma membrane burst, the cell burst. So plasma membrane में आ जाएंगे defect. There are defects in the plasma membrane. So because of which there is leakage, leakage is present and inflammation is present. Inflammation is present. Have you got it? And after that, the fourth difference, apoptosis occurs of a single cell, but necrosis occurs of a cluster, a group of cell, cluster of cell. Give me a thumbs up. Have you got it? Have you got it? The differences till now, these are the four. I will tell you many more, right? So that is the thing. So can I say apoptosis is a programmed cell death? It is already genetically programmed. The genes are involved in apoptosis. I will tell you the mechanism. It is genetically programmed. It is a programmed cell death. It is genetically programmed and it is energy dependent. Energy dependence means for doing apoptosis ATP is required. So यहाँ मरना भी मुफ्त में नहीं है. If the cell want to commit the suicide, he has to invest ATP. The cell has to invest ATP, otherwise cell even cannot die. For life you require ATP, you require money, but for death also you require money. If someone wants to commit suicide, he has to purchase poison, na? Without poison, without purchasing, so he has to invest the money for that. Have you got it? So these are the definitions. So there is one poll. I want you to write the answer based on the definition. I am done with the definition of apoptosis. Now I'm coming to the next topic. So please read this question and tell me what is the answer. What is central to apoptosis? It is the utilization of which enzyme? Utilization of nitrous oxide, adenyl cyclase, caspase or cyclic AMP. In the definition, I have already taught you. So Sophie, do you want to tell me what is the answer? Or anyone else who's listening to me? Do you want to tell me what is the answer? What is the answer here? Yes, very good. Caspase, Sophie, very good. So as I've told you, caspase is the enzyme which got activated during the process of apoptosis. So the correct answer here is C. It was a very easy question. Anyways, after definition, let me come on the type of apoptosis. Let me come to the second heading. There are two types of apoptosis. What are the two types of apoptosis? The two types of apoptosis is physiological and pathological. Physiological is programmed cell death and pathological is unprogrammed cell death. Physiological means it occurs normally. Can anyone of you tell me the few examples of physiological apoptosis? Tell me few examples of physiological and few examples of pathological. Can anyone? Physiological apoptosis. Physiological and pathological are the two types of apoptosis. Tell me few examples here, few examples here. Okay, let me tell you the few examples of physiological apoptosis. Physiological apoptosis. You know, the best example is embryogenesis. Let me draw a diagram for you. So this is the uterus of the mother. Inside the uterus of the mother, this is the fetus. Let me draw a fetus. This is the fetus inside the uterus of the mother. So you know, when the fetus is there is all the organs of the fetus are formed one by one. So the process is known as embryogenesis. Embryogenesis. We have studied the complete embryogenesis and embryology subject. So you may have studied it, right? Yes. So embryogenesis is taking place inside the embryo. So how does the hands are formed? Yes, Sophia, I'm coming on these points. Endometrium after parturition. I'm coming on that. So after parturition, endometrium is going to be apoptosis. Yes, I will come. It is one of the example, right? So embryogenesis, may first you tell me the example in embryogenesis. How the hands are formed? My question, how the hands? So hands are formed like this. Initially the hands are like the block. Now the cells, just a second, the cells between various digits undergo apoptosis. So there were cells present between two fingers, they undergo apoptosis. In this way we got various digits. Now the hands, the shape of the hands is like this. So the cells between the various digits undergo apoptosis. So there is apoptosis which is taking place in these cells. Have you got it? So interdigital cells undergo apoptosis so that digits are formed in the hands also, in the foots also. That is the best. Not only here, there are various other examples also in embryogenesis where apoptosis takes place. So this is physiological. It is not a disease. Have you got it? So the first example is embryogenesis, in which the digits are formed. So interdigital cells undergo apoptosis. Number one. Now in human body we have lymphocytes. Lymphocytes are a type of WBC. We have 5 type of WBC. One of them is lymphocyte. Now normally all WBC and lymphocytes kill the foreign. They kill the foreign material, not the cells. But sometimes these lymphocytes become mad. ये पागल हो जाते हैं and they start killing self. They start, instead of foreign, they start killing the self material. self cells. Now these are not good for us. The person will have autoimmune disease if they survive. So whenever self-reacting lymphocytes are formed, the body kill them by apoptosis. So inside human body, just suppose inside my blood, if any of my lymphocyte become mad, it becomes self-reactive. So body will kill them. The body will kill them from apoptosis. The lymphocyte will get external signal and the lymphocyte will be killed. Have you got it? We will give the signal to the lymphocyte that your function is already over in the body. We know no more we need you. So please commit suicide. And this lymphocyte, the abnormal lymphocyte, will commit the suicide. Right? So the third one, as Sufi told us, it is involution of the uterus and the breast after pregnancy. That is in parturition. So, okay, let me draw a diagram. So this is the uterus normally the size of the uterus is like this is a normal uterus, right? During pregnancy the uterus increases in size to accommodate the fetus inside it. Now the uterus want to accommodate the fetus inside it, that's why it increases in size. How it increases in size? In adaptations, I have already told you, it increases in size by two adaptation, by hypertrophy as well as hyperplasia. Because of increase in size of the cell and number of the cell, the size and number of the cell both is increasing, that's why it will lead to increase in size. But after delivery, the fetus is out, after delivery it again decreases in size, so this is through apoptosis of the cell. So this is through apoptosis, that is parturition. The same happens of the breast. During pregnancy, the breast size in the female increases drastically, and after pregnancy it again reduced to normal. After lactation or pregnancy it reduced to normal. So it is due to apoptosis. Have you got it? So it is involution of the uterus and breast after pregnancy, that is hormone dependent. Have you got it? So these are death of the cells which have already completed their function. These are the examples of physiological apoptosis. Let me come on few examples of pathological apoptosis now. Pathological apoptosis. In the AIDS is caused by a virus. The name of the virus is HIV virus. Human, HIV virus. So HIV virus kills which cells? So it kills the lymphocytes. It kills lymphocyte, not neutrophils. Lymphocyte mein it is CD4 T lymphocytes. There are two type of lymphocyte, B lymphocyte and T lymphocyte. T lymphocyte are further two types, CD4 and CD8. So the AIDS virus, HIV virus kills CD4 T lymphocytes, not B lymphocyte, not CD8. So it is through apoptosis, and which will cause a disease known as AIDS. Have you got it? So that is the thing. Or after that, you can learn like that during chemotherapy. In cancers, we give chemotherapy, no? So whenever a patient with cancer given the chemotherapeutic drug go inside the body of the patient and kill the cancer cell. How chemotherapy drug kill cancer cell? It is via apoptosis. Have you got it? So that is the thing. So chemotherapy drug don't know this is a cancer cell. So whenever we give, just suppose this is a human body, the patient is having cancer at any part of the body. I don't know at which part. Okay, let me say the patient is having a cancer in the breast or in the stomach, in the brain, in the bone, in the muscle, anywhere the patient is having cancer. Now I'm giving chemotherapy to this patient, either orally or IV. So the drug is going inside the body. Now this is chemotherapy drug. The drug has a rule. The chemotherapy drug will kill all actively dividing cells in the body. All fast dividing cells in the body. Cancer cells are one of the cells which are fast dividing. So these cells are killed. Cancer cells are killed. Cancer cells, because they are fast dividing. Apart from cancer cell, there are many other cells in normal human body which are fast dividing. What are those? Number one, hematopoietic stem cells of the bone marrow. That's why the person on chemotherapy have pancytopenia as a side effect, because the hematopoietic stem cells are killed by the by the chemotherapy agent as a side effect, so hematopoietic stem cells are killed. So RBC, WBC, platelet are not formed. Patient have anemias on chemotherapy. The hair follicles in the head, the hair follicles are very fast dividing, so chemotherapy also kills the hair follicles, so patient become bald. So chemotherapy patients become bald. So this is the reason. So these are the side effects of the chemotherapy. Have you got it? Anyways, let me come on the mechanism of apoptosis. The most important thing here to understand the mechanism of apoptosis. Please, everyone give me a thumbs up, right? So we have done the definition of apoptosis. That is, it is cell suicide. So cell will commit suicide because of two reasons. Either the function of the cell in the body is over, or DNA of the cell is damaged too much that it cannot be repaired now. It is unrepairable. So because of which the cell will commit suicide. For committing suicide, the cell will activate certain enzymes. The name of the enzyme is caspase in the cytoplasm. Caspase will degrade the cytoplasm, nucleus, cell membrane of the own cell, and convert the entire cell into multiple apoptotic bodies. In the end, a phagocyte will come and eat or engulf all the apoptotic bodies. In the entire process, there is no leakage, there is no inflammation, the plasma membrane is intact. That is the complete definition of apoptosis, which I have told you verbally, right? Now, coming on the types of apoptosis, there are two types of apoptosis: physiological apoptosis and pathological apoptosis. I have told you examples of physiological as well as pathological apoptosis. You already know the examples. Now, let me come on the mechanism of apoptosis. How does it take place? Are you people with me? Give me a thumbs up. Should I start the mechanism? Now, I'm warning it is difficult. So please concentrate. It is difficult. Let me start the mechanism. As I have already told you, the signal can come from outside or the signal can come from inside. Inside means nucleus. If the signal is coming from outside, it is known as extrinsic pathway. If the signal is coming from inside, it is known as intrinsic pathway. I've already told you this is a cell. This is the nucleus of the cell. This is the DNA of the cell. Now, if the cell want to do apoptosis, either the signal will come from outside, that the signal will be that your function is over, now you please commit suicide. That is extrinsic pathway. Or if the DNA of the cell is damaged too much, so this DNA will give signal to the cell. That is, the signal is coming from inside. That is, I am damaged, now you please commit suicide, I am unrepairable. So here it is known as intrinsic pathway. So based on the signal, whether the signal is coming from outside or inside, it is of two types: extrinsic pathway, intrinsic pathway. In each of the pathway, extrinsic one and intrinsic one, there are two phases: initiation, execution. Initiation, execution. Now listen the story what I am saying. Sufi, listen the story what I am saying. I am saying that the execution of both the pathways same. So I will teach you execution in the end. So what will be my sequence of teaching you? First I will teach you initiation. It will be like a movie story. It is a big story, right? But very interesting and a difficult one. So first I will teach you initiation phase of extrinsic pathway. Then I will teach you initiation phase of intrinsic pathway. And in the end, I will teach you execution phase of both together. Give me a thumbs up if you got the sequence. Everyone give me a thumbs up if you got the sequence. So first I will teach you initiation of extrinsic pathway. So I will start the story and leave the story in middle at intermission. Intermission के बाद की story I will tell you later on. Then I will tell you another movie story, initiation of intrinsic pathway. Again, I will leave the story at intermission. And after intermission, the movie story of the two movies, the story of the two movies is same. So after intermission, execution is same for both. Give me a thumbs up. Give me a thumbs up if you got it. Should I start? So let me start with extrinsic pathway ka initiation phase. I'm starting extrinsic pathway ka initiation phase. Give me a thumbs up. Give me a thumbs up. Can you see a cell? This is a human cell. All human cells have receptors on their surface. The red color receptors you can notice on the surface, these are the death receptors. These are the death receptors. These are present on all human body cell. From head to toe, these receptors are present. Death receptors are of two types. The name of the death receptors is either CD95 or FAS receptor, one and the same thing. Number one, FAS receptor or CD95 receptor. Second is TNF, tumor necrotic factor receptor. So one of the two receptors are present, either FAS, CD95, one and the same thing, and TNF receptors. These receptors are present on the surface of the cell, and these are death receptors. These are known as death receptors, right? These are death receptors. So let me draw a sketch diagram for you. Can you see a beautiful cell in front of you? Can you all notice a beautiful cell in front of you? Of course you can see. I have drawn this diagram for you. See the nucleus of the cell, see the DNA of the cell, see the cell membrane. On the cell membrane, can you appreciate the red color receptors? These red color receptors are death receptor. I have labeled them. These are FAS, CD95 or TNF receptors. Have you got it? Now I am teaching you extrinsic pathway. Which pathway? I am teaching you extrinsic pathway. So here the signal will come from outside. From where the signal will come? The signal will come from outside. The signal will be in the form of the ligand. Can you see a yellow color ligand here? This one. Please appreciate this yellow color ligand. This is FAS ligand. It is not FAS receptor. It is FAS ligand. It is the signal. The yellow color. It is the signal. It is carrying the signal for the cell that you have to commit suicide now. You have to die now. So it is the signal. So this signal is coming. This is FAS ligand. When ligand comes and bind with the receptor. This is FAS receptor. This is FAS ligand. So see in this the next diagram, let me zoom it out. This is FAS ligand. It will bind with FAS receptor. So it will come and bind with FAS receptor. So here the signal is coming from outside. That's why it is known as extrinsic pathway. So once it comes, can you see right now the various death receptors? This one is the first one. This is second one. This is third one. This is fourth one. All the death receptors are at certain distance from each other. They are at certain distance from each other. Have you got it? Yes or no? They are at certain distance from each other. Give me a minute, just a second. Okay, they are at certain distance. But when the ligand will come, can you see the ligand? When the fast ligand is coming, binding with the fast receptor. This is fast ligand, bind with the fast receptor. Multiple fast receptors come together. Multiple fast receptors come together and they will form a domain. They will form a domain. This is known as death domain. The name is FADD. It is known as fast associated death domain. This terminology is given in Robbins only, FADD. So ultimately FADD is formed when a fast ligand is coming, binding with fast receptor, giving the signal that you have to commit suicide. So this is the signal. Here the signal is coming from outside. Can you see ligand is coming from outside? That's why it is known as extrinsic pathway. So a ligand is coming. It is binding with the receptor. Who is the ligand? It is fast ligand and it is binding with fast receptor. Or it is TNF ligand bind with the TNF receptor, right? So it will come bind with the receptor, multiple receptors will come together, they will form a death domain. The name of the death domain is fast associated death domain. So because of formation of this domain, now this is cytoplasm of the cell. Now inside the cell cytoplasm, various caspase are present. All of them are inactive. All of them, due to the formation of this domain, the first caspase which is activated is caspase number 8. So pro-caspase 8 get converted into active caspase 8. So caspase number 8 is the first caspase which is activated in extrinsic pathway. Please learn it. Beautiful diagram. Give me a thumbs up. Give me a thumbs up. So what is the story? So can you see the same diagram in the Robbins? Can you see this is fast ligand, the yellow color fast ligand. It is coming. This is the cell membrane. On the cell membrane, can you see the red color? It is the receptor, fast receptor. Can you see the ligand is coming binding with the receptor? When ligand is coming binding with the receptor, multiple death receptor comes together. These are the receptors, they come together and because of which a domain is formed. Then can you see this is the domain, death domain. So name of the domain is fast associated death domain. Because of formation of this domain, can you see the green color? Pro-caspase 8 got converted into active caspase 8. So active caspase 8 is formed. You can write like this. So whenever fast ligand come, bind with fast receptor. This is ligand bind with the receptor. Multiple receptors come together and they will form a death domain. The name of the death domain is fast associated death domain, FADD, fast associated death domain. Because of formation of this domain, the pro-caspase 8 get converted into active caspase 8. So beautiful diagram. Can you see this is ligand? It is coming binding with the receptor. Fast ligand coming binding with fast receptor. Multiple fast receptors come together and they will form a domain. The name of the domain is fast associated death domain. So in the cytoplasm, various caspase are present. So the first caspase which become activated because of formation of this domain is caspase number 8, which is very important MCQ, repeated many times. So caspase 8 is the first caspase which get activated in extrinsic pathway. Right, and caspase 8 will be activated. Caspase 8 will be activated. Initially, the receptors were separate. When ligand come and bind with the receptor, multiple receptors come together. All these receptors will come together and they will form the domain. Now, I hope you got it. I hope you got it. Instead of fast receptor, the second type of receptor is TNF receptor. So, if you talk about TNF receptor, instead of, can you see, here the ligand is TNF ligand and the receptor is TNF receptor. So, the combination, ligand receptor combination can be fast and can be TNF, one and the same thing. So same story will be TNF also. Same story will be with TNF also. So when TNF ligand is coming, binding with TNF receptor, multiple TNF receptors come together and they will form a domain. The name of the domain here is TRAD, TNF receptor associated death domain. So it is TNF receptor associated death domain. Ultimately, this receptor also convert pro-caspase 8 into active caspase 8. So caspase 8 is activated. So there are two types of death domain, the fast and the TNF. The story of both is same. So if TNF ligand is coming, binding with TNF receptor, multiple TNF receptors come together and they will form a death domain. The name of the death domain is TNF receptor associated death domain. Ultimately, it also converts pro-caspase 8 into active caspase 8. So what is the story? I have told you extrinsic pathway ka initiation phase. Extrinsic pathway ka initiation phase is completed and I am leaving the story here. Please hold the story. It is the intermission of the movie. Intermission of the movie. After intermission, the movie will be continued later on, right? So extrinsic pathway ka initiation phase I am leaving here. Caspase 8 ka activation. How it is done? Either by fast receptor or TNF receptor, either by TNF receptor. One of the two receptor ligand, fast is also known as CD95. In दोनों के जरिए caspase 8 is activated. Now what happened to this caspase? I will tell you in execution phase later on. Later on. Let me teach you initiation phase of intrinsic first. So I will take execution in the end of both together. So I am starting another story now. Another story. I am teaching you intrinsic pathway now. I'm not teaching you extrinsic now. I'm teaching you intrinsic pathway. Intrinsic pathway का initiation. Let me teach you. यहाँ की story तुम याद रखना. You just remember the story where we are living. So we are living at Caspase 8. I will continue from Caspase 8 only in execution later on. Right. So first let me teach you intrinsic pathway ka initiation. Now as here it is extrinsic pathway, so the signal was coming from outside in the form of the ligand. Here it is intrinsic, so signal will come from inside, from the DNA. Okay, so here the signal is DNA damage. See, this is a cell, a beautiful cell. First give me a thumbs up. Can you see a beautiful cell in front of you? You all can see. Inside the cell, can you appreciate the DNA? Can you appreciate the nucleus? Inside the nucleus, please appreciate the double stranded DNA. It is normal, till now it is not damaged. See the mitochondria of the cell. Mitochondria have two membranes. This is inner membrane of the mitochondria. This is outer membrane of the mitochondria. And between the two membranes of the mitochondria, please appreciate this is cytochrome C. This is cytochrome C, which is present between the two membranes of the mitochondria. Till now, everything is okay. Mitochondria is performing its own function. DNA is performing its own function. This is cytochrome C. Cytochrome C is a protein which is present between two membranes of mitochondria. It never comes out. If it comes out in the cytoplasm, cell will commit suicide. So, okay, I will do that. I will do that. Let me zoom it out. Let me zoom it out. So, as I have told you, cytochrome C is the protein which is already always present between the two membranes of the mitochondria, inner and outer. So, who is now outer membrane have a door now? We know that mitochondrial outer membrane have a transit. The transit is the door. This is a transit. This is mitochondrial transit. The transit. What do you mean by transit? Transit means door. It is the door of the mitochondria. So you should ask me a question, ma'am, why this cytochrome C is not coming out of this door? Why it is not? Who is preventing cytochrome C to remain inside only? Who is preventing the cytochrome C to remain? Now there are two guards. The God has given us two guards. The two guards, guards means chokidar. They are preventing cytochrome C to come. They are closing the door and inhibiting cytochrome C to come out. So what is the name of those two guards? There are two proteins. The name of the two proteins is BCL2 and BCLX. Learn one more, MCL. So learn three guards. So there are three guards who are preventing cytochrome C to come out of the mitochondria in the cytoplasm. They just close the door of the mitochondria. They just close the transit. So they are always closing the door and the transit and inhibiting or preventing cytochrome C to come out. So they are preventing apoptosis. If cytochrome C comes out, apoptosis will happen. So they are preventing apoptosis. That's why these three guards are known as anti-apoptotic proteins. Anti-apoptotic proteins. Anti-apoptotic proteins के नाम बताओ. How many anti-apoptotic proteins you know? It is BCL2, it is BCLX, it is MCL. These three are anti-apoptotic proteins. Give me a thumbs up if you got it. Everyone give me a thumbs up. So these are preventing. Till now everything is okay. Right? Now this DNA is healthy till now. Now imagine a situation the DNA is damaged. The DNA is damaged, so first P53 will come and try to repair it. P53 is a DNA repair gene. So first we will give a chance to P53 that please repair the DNA. Due to some mutation, the DNA is damaged. But P53, the damage is too much. It is extensive damage and P53 is unable to repair it. So P53 say, no, I cannot repair it. The damage is too much. Now let's kill this cell. Let's kill, because the DNA is damaged beyond repair. We have to kill this cell. We cannot keep a cell with damaged DNA keep alive. We cannot keep it alive. Body will not allow it. Because if the DNA is damaged, means DNA is having mutations. Damage matlab kya? The DNA is having mutations. So a mutated cell will lead to cancer. It will lead to cancer. If we allow it to survive, it will divide and form a cancer. We do not want humans to have cancer. That's why body automatically eliminate it. Body want to eliminate it. So here DNA, the nucleus will give signal to the mitochondria that I am damaged. I am damaged. Please kill the cell. Please initiate the process of apoptosis. We have to kill this cell now. This cell cannot survive more because I am damaged. The DNA is saying this to mitochondria by sending signal. So here signal is coming from inside of the cell. Inside of the cell to inside of the cell. That's why it is intrinsic pathway. Give me a thumbs up. You got it? It is intrinsic pathway. So as soon as the mitochondria is receiving this signal from the DNA, it is intrinsic signal, right? Inside signal. That DNA is damaged. So what does the mitochondria will do? Now listen the story. What does the mitochondria will do? Mitochondria will replace the two guards or three guards which were closing the door by three another guards which will open the door, right? So what is the name of these guards now? अब दूसरे चौकीदार आ जाएंगे यहाँ. Here another guards will come. They will open the door. They will open the door. The name of the guards are Bak, Bim and Bad. One more add. Bad. Baks, Bad, Bim and Bad. Right? They will open the door. They will open the door and allow cytochrome C to come out. So these are allowing apoptosis to happen. That's why these are known as pro-apoptotic proteins. Pro-apoptotic proteins. So initially we were having anti-apoptotic proteins, and now we have pro-apoptotic proteins. So on the mitochondria, let me draw a mitochondria separately. These are the two membranes of the mitochondria. Between the two membranes of the mitochondria, we have cytochrome C. This is cytochrome C. Now this is mitochondrial transit. Let me draw a mitochondrial transit. So this is a mitochondrial transit. Initially we have anti-apoptotic proteins on the door, on the transit. Anti-apoptotic proteins, apoptotic proteins. That is BCL2, BCLX and MCL. They are closing. All the anti-apoptotic proteins are closing the transit. So they are inhibiting cytochrome C to come out and preventing apoptosis to happen. When this mitochondria receive the signal from the nucleus, the anti-apoptotic are replaced. They are replaced by another protein. Another protein are pro-apoptotic proteins. These are replaced by pro-apoptotic proteins. What is the name? There are four. It is BAX, BAD, BIM and BARC. Right? There are many others also. These are important four. So they will open the transit. They will open the door and allow the cytochrome C to come in the cytoplasm. So whenever mitochondria receive the signal from the DNA, the anti-apoptotic proteins are replaced by pro-apoptotic proteins. Give me a thumbs up. Yes, very good, Sophie. Very good. Have you got it? Have you got it? So these are, so cytochrome C will come out. So what will happen? You can see cytochrome C is coming out. Appreciate here, cytochrome C is coming in the cytoplasm. After coming, see, cytochrome C is coming in the cytoplasm because of replacement of anti-apoptotic proteins by pro-apoptotic proteins. So this replacement take place. So the door opens. Because of opening of the door, this cytochrome C is coming out in the cytoplasm. After coming in the cytoplasm, what does it do? What does this will do? What the cytochrome C will do? Now in the cytoplasm, various caspase are present. Caspase 1, 2, 3, 4, 5, 6, all of them are inactive, as I have told you. Let me talk about caspase number 9. Caspase number 9. Procaspase 9. It is an active caspase. All the caspase are present in the cytoplasm in inactive form, in pro form. It is procaspase 9. Now, caspase 9 का best friend है APAF1. What is APAF1? It is another protein. What is the full form of APAF? Apoptotic activating factor. Apoptotic activating factor 1. These two are the best friend. They always travel together. APAF1 and caspase 9. Inactive caspase 9. APAF1 and inactive caspase 9. That is procaspase 9. These are the best friends. They always travel as a duet. They always travel together. You cannot separate them, right? They are the best friends in the cytoplasm. They always travel together. Now there is a rule. The rule is that जब तक caspase 9 APAF1 की संगत में रहेगा, ये एक्टिव नहीं होगा. What I am saying, till the point procaspase 9 will remain in combination with APAF1, it will remain inactive only. Now the cytochrome C, after coming in the cytoplasm, the cytochrome C is leaked in the cytoplasm. Now there is leakage of cytochrome C in the cytoplasm. After coming in cytoplasm, the cytochrome C will take APAF1 with him. उसको बोलेगा उसको छोड़ मेरे साथ चल. I am your good friend. Leave your old friend. I am your new friend. Please come with me. Leave that alone. Leave that alone. So this cytochrome C will take APAF1 with him. This cytochrome C will take APAF1 with him. So procaspase 9 is alone now and it will get converted into active caspase 9. Can you see procaspase 9 get converted into active caspase 9? One cytochrome C break the pair of the best friend. Give me a thumbs up. So the first caspase which become activated in intrinsic pathway is caspase 9. What was the first caspase which was activated in extrinsic pathway? Anyone? What was the first caspase? I have told you extrinsic pathway का first caspase कौन सा है and intrinsic pathway का first caspase कौन सा है? In extrinsic pathway, the first caspase which is activated is caspase number 8. And here we are saying it is caspase number 9. Give me a thumbs up. So here the same diagram is from Robbins. Can you see? Should I explain you this diagram? Can you see this is inner mitochondrial membrane? This one is inner mitochondrial membrane and this one is outer mitochondrial membrane. Please appreciate the door or the transit on the outer mitochondrial membrane. This is the transit. Yes, Sufi. Very good. It is caspase 8. It is our outer mitochondrial membrane. This is the door or the transit. Please appreciate this is cytochrome C. It is present between the two membranes, right? Initially, the door is closed by BCL2. Not only BCL2, BCLX and MCL. These are anti-apoptotic proteins. When this cell get the signal from the DNA, that DNA is damaged beyond repair. It is not shown here. These three guards are replaced by another guards. Name of the guards is BARCs, BAD, BIM and BARC. They will open the door. Once the door is opened, this cytochrome C will leak out in the cytoplasm and come in the cytoplasm. This is the cytoplasm. Now in the cytoplasm, see the best friend pair. The pair of a best friend, the two. The green one is the procaspase 9 and the purple one is a PAF1. Can you see procaspase 9 and PAF1? They are present in pair. So till procaspase 9 is in combination with APAF1, the procaspase 9 will remain inactive only. So the cytochrome C will break the pair. Cytochrome C will come and take APAF1 with him. So procaspase 9 converted into active caspase 9. Give me a thumbs up. So the same thing is written in front of you. Whenever the cell is receiving stimulus, what is the stimulus here? Sufi, what is the stimulus here? The stimulus here is coming from inside. It is DNA damage. It is DNA damage. So whenever DNA is damaged beyond repair, the anti-apoptotic are replaced by pro-apoptotic. What are anti-apoptotic? BCL2, BCLX, MCL. And they are replaced by pro-apoptotic. BARCs, BAD, BIM, BAD. They are replaced by pro-apoptotic. Because the anti-apoptotic are replaced by pro-apoptotic, the mitochondrial permeability is increased. That is, the transit will open. The door will open, the transit will open, permeability will increase. And cytochrome C will leak into the cytoplasm. So cytochrome C will come in the cytoplasm. After coming in the cytoplasm, it will activate procaspase 9 by taking APAF1 with him. तो cytochrome C caspase 9 को activate करने के लिए APAF1 का सहारा लेता है. It will take APAF1 with him so that caspase 9 will become activated. So the story ends here. Have you got it? So what are anti-apoptotic proteins? BCL2, BCLX, MCL and FLIP. These are four anti-apoptotic proteins which closes the door and they inhibit cytochrome C to come out. Right? What are pro-apoptotic proteins? The important one are BARCs, BAD, BIM and BARC. These are the important one, P53, APAF1, cytochrome C, and they open the door and allow cytochrome C to come out. Yes or no? Yes or no? So that is the thing. So here the main role of intrinsic pathway is the mitochondria. So till now I have completed two stories. Before intermission, those stories complete हो गई हैं. Extrinsic pathway का initiation, intrinsic pathway का initiation. I left both the stories in between. So extrinsic pathway ka initiation, I left at activation of caspase 8. What is ahead? What is the story ahead? And intrinsic pathway ka initiation, I have left the story at activation of caspase 9. What is ahead? Ab aage ki story kya? What is the movie ahead? What is the story ahead of both the stories? Let me continue both stories together in one movie after intermission, that is execution. So execution is common for both. Give me a thumbs up. Everyone give me a, let me teach you execution of both together, extrinsic as well as intrinsic. Give me a thumbs up. So I am teaching you execution phase. It is a convergent phase of both. It is the common phase or convergence phase for both extrinsic pathway as well as intrinsic pathway. Extrinsic as well as intrinsic, both pathways, the common phase. So in extrinsic pathway, the first caspase to be activated is caspase 8. In intrinsic pathway, the first caspase to be activated is caspase 9. What's the story ahead? Uske aage kya? Uske aage kya? Caspase 8 here and caspase 9 here activate another caspase. It is caspase 3 and 7. So 8 also activate 3 and 7. 9 also activate 3 and 7. And this 3 and 7 activate all other caspase. So ultimately all the caspases are activated. Now this is a cell and all the caspases, all 1, 2, 3, 4, 5, 6, all caspases are activated either by extrinsic pathway or by intrinsic pathway. If it is extrinsic pathway, caspase 8 is the first one to be activated. If it is intrinsic pathway, caspase 9 is the first caspase to be activated. Ultimately here 8 and here 9 leading to activation of all other caspases. Once all the caspases are activated, imagine all these caspases are activated. So caspase will degrade three things. They are the suicide bag. They will degrade three things. Number one, cytoplasm of the cell, nucleus of the cell and cell membrane of the cell. So cytoplasm, nucleus, cell membrane will be degraded and entire cell will be converted into multiple small apoptotic bodies. So can you see? This is one of the apoptotic body containing a small amount of plasma membrane, a small amount of cytoplasm, a small amount of nucleus. This is another apoptotic body containing a small amount of same three things. Give me a thumbs up. In the end, a phagocyte will come. A phagocyte, can you see a green color cell? It will engulf or eat or engulf all the apoptotic bodies. So the cell is disappeared. There is no leakage, there is no inflammation. Everyone give me a thumbs up. So can I say that in initiation phase, the two caspases which are activated is caspase 8 and 9. If it is extrinsic pathway, it is caspase 8. If it is intrinsic pathway, it is caspase 9. So caspase 8 is the first caspase to be activated in initiation phase of extrinsic pathway. Caspase 9 is the first caspase to be activated in initiation phase of intrinsic pathway. In execution phase, it is caspase 3 and 7 together. Either it is intrinsic pathway or extrinsic pathway, it is caspase 3 and 7. Now please understand your question very beautifully in your exam. Tell me the caspase. Tell me the name of the caspase. You tell me the name of the caspase. So the caspase of the initiation phase. The caspase of the initiation phase, just a second. The caspase of execution phase. The caspase of execution phase. Let me finish my questions. Initiation phase of intrinsic pathway. Initiation phase of extrinsic pathway. Execution phase of intrinsic pathway and execution phase of extrinsic pathway. Who will tell me the four answers? Who will tell me the four answers? Who will? Sufi, Dhananjay, Navneeta, Yammer, anyone who else is listening to me. Can you tell me the four answers one by one? So tell me the first. Yes, Sufi, you here. So initiation phase of intrinsic pathway. What is the answer? Initiation phase of intrinsic pathway. Initiation phase of intrinsic pathway is caspase 9. Initiation phase of extrinsic pathway, it is caspase 8. Execution phase of intrinsic pathway. Execution phase of intrinsic pathway, it is 3 and 7 both. Execution phase of extrinsic pathway, again it is 3 and 7. I hope you got it. Give me a thumbs up. Everyone give me a thumbs up. So please understand your question in your exam first before reaching to the answer. Don't just jump on the answer. Don't just rush on the answer. Have you got it? So that is the thing. That is the thing. So I am done with the mechanism. I am done with the mechanism of extrinsic pathway, mechanism of the intrinsic pathway. Do you have any doubt? Anyone having any doubt in this? No, no one. In the end, the last phase of all four is phagocytosis. As I've told you, in the end, a phagocyte is coming and eating all the apoptotic bodies. The phagocyte is coming and engulfing all the apoptotic bodies. I have told you already. Give me a thumbs up, yes or no. I have told you this thing. So in the end, a phagocyte is coming and engulfing or eating all the apoptotic bodies. We have seen that. We have seen that. So phagocytosis. It is phagocytosis. I want to ask you one question here about phagocytosis. I want to ask you one question. Can you see a phagocyte is there? This is coming and eating all the apoptotic bodies. My question to you is that this is a phagocytic cell. It is a phagocytic cell. The green color cell is the phagocytic cell. Phagocytic cell don't have eyes. So how does the phagocyte cell or phagocytic cell decide that it is a normal cell? I don't have to eat it. And this is the apoptotic cell. I have to eat it. How does it decide? Does anyone know? Does anyone know? Sophie, do you know this? How does the phagocyte will decide whether it is a normal cell? I have to engulf. I don't have to engulf this, and this is a apoptotic cell. I have to engulf this. Do you know this? Apposition, opsonization process, opsonization. Okay, you want to say opsonization? Yes. So opsonization is the tagging. So what molecule is causing opsonization? You know the name of the molecule? Okay, let me tell you. So what is happening? Have you got your question? No, let me tell you the answer of this. Let me tell you the answer. So actually, what is happening? See, this is a normal cell. See the difference between the normal cell and apoptotic cell. This is a normal cell. This is a apoptotic cell. See, in the normal cell, on the inner surface of the cell membrane, there is a protein. The name of the protein is phosphatidylserine. The name of the protein is phosphatidylserine. Phosphatidylserine. The name of the protein is phosphatidylserine. It is present on the inner. You can see clearly in the diagram, inner surface of the cell membrane. But during apoptosis, when this cell convert into apoptotic bodies, from one cell, multiple small bodies are formed. Can you see? The bodies are about to form. That is, apoptotic bodies are forming. There is flip flap. There is flipping of the cell membrane. Ulta pulti. Cell membrane ki ulta pulti ho jayegi. So the inner surface of the cell membrane goes to outer and outer surface of the cell membrane comes to inner. So the phosphatidylserine goes on the outer surface of the cell membrane. This phosphatidylserine goes on the outer surface of the cell membrane during apoptosis. Give me a thumbs up. So it is the phosphatidylserine which is causing the tagging or opsonization Sufi you are talking about. So tagging. So it's tagging kar diya na. So now now it's very easy. The phagocyte will come. Phagocyte will judge for PS, phosphatidylserine receptors. The cell which is having phosphatidylserine receptors on the outer surface, phagocyte will eat it. And the cell in which phosphatidylserine is present on the inner surface, phagocyte will not eat it. So that is phosphatidylserine is doing the tagging of the cell. So when phosphatidylserine, the summary is that when phosphatidylserine present on the outer surface, that cell will undergo phagocytosis. It is an apoptotic cell and that will undergo phagocytosis. And when phosphatidylserine is present on the inner surface of the cell membrane, it is a normal cell and it will not undergo phagocytosis. So phagocyte will test, it will judge for phosphatidylserine which is causing the tagging. Give me a thumbs up. Give me a thumbs up. So the answer here is phosphatidylserine, which is a very important MCQ, repeated again and again. So phosphatidylserine, it is a phospholipid. It is not a protein, I'm sorry. It is a phospholipid. Normally it is present on the inner surface of the cell membrane. Inner surface. But during apoptosis, it is flipped to the outer surface. Flip flap occurs to the outer surface. And during this flip flap, the phosphatidylserine, it is known as externalization of phosphatidylserine, which is causing the tagging. Now phagocyte can recognize it and can engulf it. Sophie, give me a thumbs up. You got it. So same diagram from Robbins. You can see the same diagram from Robbins. See the cell membrane. Appreciate the cell membrane here. Please appreciate this cell membrane here, and please appreciate this cell membrane here. So this is a normal cell. Please appreciate the phosphatidylserine here on the inner surface of the cell membrane. It is on the inner surface of the cell membrane. And please appreciate the phosphatidylserine here is the outer surface of the cell membrane. Can you see it is on the outer surface of the cell membrane? It is on inner surface, it is on outer surface. So this is doing the tagging. It is the flipping taking place. It is doing the tagging. So we are done with phagocytosis. I'm sorry. How tagging occurs in phagocytosis. So ultimately apoptosis is over. During the entire apoptosis, we have seen inflammation is absent. There is no leakage because cell membrane is intact. During the entire apoptosis, the cell membrane is intact. So there is no leakage, there is no inflammation. Inflammation is virtually absent, which differentiated from necrosis. So essential feature of apoptosis is immediate, specific, non-inflammatory nature of phagocytosis. Phagocytosis is non-inflammatory. I am done. I am done with the mechanism of apoptosis. Now I will teach you morphology and diagnosis of apoptosis and how to differentiate the apoptosis from necrosis. Let me teach you this. Give me a thumbs up. Are you people there? Everyone give me a thumbs up. So before that, I would like to launch some polls. You have to write your answer in the chat box. What is the correct answer here? Those who are listening, please tell me the correct answer. Very easy question. CD95 is a marker of. It is a marker of what? It is a marker of intrinsic pathway of apoptosis or extrinsic pathway of apoptosis. Where we have read CD95. Who would like to tell me the answer? Sophie, would you like to tell? Anyone else who is listening to me? Please write your answer. CD90. Okay, let me give you a clue. CD95 is known as FAS. FAS. It is the another name of the FAS. So FAS we have studied in which pathway? FAS we have studied in which pathway? So Sophie, you are right. Anyone else want to give a try? Please give a try. So yes, it is seen in extrinsic pathway of apoptosis. So FAS receptor, it is a death receptor. So we have seen death receptor in extrinsic pathway, not in intrinsic pathway. In intrinsic pathway, there was a role of cytochrome C, but not of FAS. So the correct answer here is B. I want everyone to write your answer in the comment box. At max, you will be wrong. It's okay, but please write it down. No? Correct answer here is B. You will learn from your mistakes. Come on. Okay, please try this. Everyone try this. In apoptosis, cytochrome C, after coming in the cytoplasm, acts through. What is the mechanism of action of cytochrome C? Cytochrome C in intrinsic pathway. Once it leak out, once it come in the cytoplasm, what does it do? After coming in the cytoplasm, does it show its action through APAF1 or through BCL2 or through FADD or through TNF? What is the mechanism of action of cytochrome C? Please tell me. I'm waiting for your answer. Please write down in the chat box. What is your answer? Yes. Dhananjay, Sufi, yes, Sufi, you are absolutely right. It is through APAF1. I have told you this. So just a second, let me show you the diagram. That in apoptosis, in intrinsic apoptosis, can you see this diagram, this one? So once cytochrome C come out in the cytoplasm, once it leaked out in the cytoplasm, there is a pair of best friend in the cytoplasm, that is APAF1 and procaspase 9. Cytochrome break the pair by taking APAF1 with him. So cytochrome take APAF1 with him. Cytochrome says to APAF1 that this is your old friend, he is not a good one, please leave this and come with me. So APAF1 is leaving procaspase 9 and coming with cytochrome C. So that is the mechanism of action of cytochrome C. So procaspase 9 become alone and it will become active, as I have told you previously. Give me a thumbs up. You got this? Give me a thumbs up. So correct answer here is APAF1. Let me come on the question again. So now see the question. Now everyone will be able to answer it. What is the correct answer? In apoptosis, cytochrome C after coming in the cytoplasm acts via APAF1. So correct answer here is A. This is the next question. You tell me what is the correct answer. Which of the following is the anti-apoptotic protein? I have told you the names of the anti-apoptotic proteins as well as pro-apoptotic proteins. Anti-apoptotic proteins are the proteins which closes the door of the mitochondria and inhibit cytochrome C to come out. Pro-apoptotic proteins are the proteins which open the door of the mitochondria and allow cytochrome C to come out. Name them. Anti-apoptotic proteins are 3 or 4 basically. It is BCL2, it is BCLX, it is MCL, and it is FLIP. Pro-apoptotic proteins are also 4. It is BARCS, BART, BARC, and BIM. These are the important ones. Now see what the examiner is asking. Examiner is asking anti-apoptotic. So anti-apoptotic protein which is present among the option among these 4. So BCLX is the answer. BCLXC is the answer. The C is the answer. BARCS, BART, and BIM. These 3 are pro-apoptotic proteins, not anti. So correct answer among them is C. Give me a thumbs up. Everyone give me a thumbs up. C is the correct answer. Please learn this table. You have to learn this table. There is no escape. Please learn it. And give me a thumbs up. Come on, give me a thumbs up. Yes, BCLX. Sufi, BCLX. Have you got it? So this is the next question in front of you. Okay, no question. We are done with definition. We are done with the two type of apoptosis, physiological and pathological. I have given you the examples of physiological and pathological. We are done with the mechanism of apoptosis, the extrinsic and the intrinsic pathway. Both pathway, initiation, execution. We have seen the diagrams, flow charts, beautifully everything. Now let me come on the next heading. The next heading is the morphological change in apoptosis. I will tell you 7 morphological changes in sequence one by one. What is happening in apoptosis? In a slide, if I give you a slide which is containing many cells, which is containing number of cells, can you identify the apoptotic cell among those a cluster of cells? Apoptosis occurs in one cell, no? Not in all cells. So can you identify that cell? Identify that cell from a cluster of cells. So what are that is the role of the morphology. How does a apoptotic cell look like? Apoptotic cell कैसे दिखेगा? So I will tell you 7 features via which you can identify a apoptotic cell. The 7 features of apoptotic cell. The first feature is cell shrinkage. Cell shrinkage, it is the earliest feature. See, this is normal cell. Normal cell is undergoing cell shrinkage. When it is becoming apoptotic, the first thing the cell will do, it will shrink in size. The first thing is, now this is the next difference between apoptosis and necrosis. In necrosis, the cells swell. If it is necrosis, the cell will swell. After swelling, it will burst. But if it is apoptosis, it is doing the shrinkage. Give me a thumbs up. So cell shrinkage is there. We are studying apoptosis, not necrosis right now. In apoptosis, there is cell shrinkage. You can appreciate the shrinkage here. That is the first thing. That is the first thing or the earliest feature. The earliest feature in apoptosis, I will tell you 7 features via which you can identify a apoptotic cell. That is the morphological changes in apoptosis. One by one, I will tell you 7 features. So the first feature is the cell shrinkage. It is the earliest feature. Earliest, इसमें बहुत MCQ आता है. The earliest feature in apoptosis is cell shrinkage. So can you see this is a normal cell, normal size cell, normal cell. When apoptosis occurs inside this cell, the first thing cell will do is cell will shrink in size. That is the difference between apoptosis and necrosis, the two type of cell death. Apoptosis is also a cell death. Necrosis is also a cell death. During apoptosis, the cells shrink, and during necrosis, the cells swell. That is the difference. Have you got it? That is the first thing. Now, this is a cell inside which the cell organelles are present. Let me draw. This is a mitochondria, endoplasmic reticulum, ribosomes. So various cell organelles are present. When the cell was normal in size, everyone was far apart. But now the cell is shrinked. So all the cell organelles are, they are clustered. Due to the clustering of the cell organelles, due to the clustering of cell organelle, the cell organelles are tightly packed now. Because of cell shrinkage, it will look more pink. The cell will look more pink. That is eosinophilia. After cell shrinkage, the second feature is the eosinophilia. Can you see the cytoplasm? Inside the cytoplasm, appreciate the clustering of the cell organelles. Due to shrinkage, all the cell organelles are packed with each other. It is known as eosinophilia. The cell will look more pink in color. That is known as eosinophilia. Give me a thumbs up. The second feature is eosinophilia. Have you got it? Now see the cell. See the first slide. There are 2 slides in this diagram. I will show you one by one. See the first slide. See the 2 cells marked by the arrow. Can you see the arrow? Can you see the arrow? This cell is smaller than other cell. The cell which is marked by arrow. This cell is smaller by other cells. And see the cytoplasm of this cell is more pink as compared to other cell. Let me zoom it out. So can you see this cell? It is smaller than the surrounding cell and it is more pink. So till now we have studied. Can you see this cell marked by the arrow? It is smaller than the surrounding cell and the cytoplasm is more pink. So till now we have studied 2 features. What are the 2 features? Cell shrinkage we can see here and eosinophilia we can see here. We can see the 2 things, cell shrinkage and eosinophilia. Third feature, come on the nucleus. What will happen to the nucleus? Nucleus में 2 चीजें होंगी. 2 things will happen in the nucleus. Number 1, pycnosis. Number 2, karyoraxis. What do you mean by pycnosis and karyoraxis? The diagrams are crystal clear. See the nucleus now. Can you see the nucleus? This is a normal nucleus. The nucleus will pack. It will become compact. So compactness, it will become more compact. Compactness of the nucleus is known as pycnosis. Pycnosis is compactness of the nucleus. So the first nucleus will become compact. It is known as pycnosis. And after becoming compact, it will do. Can you see the nucleus is fragmented? It is fragmented into multiple pieces. So fragmentation of the nucleus is known as karyoraxis. So pycnosis and karyoraxis will occur to the nucleus. That is the next two features. So first was cell shrinkage. The second was eosinophilia. The third is pycnosis. The fourth is karyoraxis. Pycnosis and karyoraxis which occur in the nucleus. These are the most specific change of the entire apoptosis. That is the most specific. If I ask earliest, answer is cell shrinkage. If I ask most specific, the answer is pycnosis and karyoraxis. Give me a thumbs up. Have you got the difference between pycnosis and karyoraxis? Give me a thumbs up. Pycnosis is compactness of the nucleus and karyoraxis is fragmentation of the nucleus. Give me a thumbs up. Come on. So have you got it? Coming on the fifth feature. Till now we have seen cell shrinkage is there, eosinophilia is there, pycnosis is there, and karyoraxis is there. Pycnosis and karyoraxis. Pycnosis is condensation or compactness. One and the same thing. Either chromatin condensation or nuclear compactness. And karyoraxis is fragmentation. Fragmentation of the nucleus due to endonuclease. It is the most specific or characteristic feature. These two. These two are the most specific and characteristic feature. Till now we are done with four. Now the fifth feature. The same diagram of pycnosis and karyoraxis. See the nucleus normally. See the nucleus here. It is compacted. Compacted means pycnosis. Condensed or compacted, one and the same thing. And see the nucleus here, it is already fragmented. Fragmentation is known as karyoraxis. It is fragmentation. Have you got it? So see the cell marked by the arrow. So see the cell, see the nucleus is compact. See here the nucleus is compact. See here it is fragmented. So we have to see the nucleus of the cell, the apoptotic cell. These are the this is the normal diagram, light microscopy. This is electron microscopy. Can you see a cell? Yes, you can see a cell. Can you see the nucleus of the cell? The nucleus of the cell is compacted. It's compact. So this is a diagram of pycnosis, right? Can you see a cell? The second cell. Yes, you all can see a second cell here in the electron microscopy. Can you see the nucleus? Oh my God, the nucleus is fragmented. It's fragmented. So this is a diagram of karyoraxis. So these are more beautifully seen on electron microscopy as compared to light microscopy. So this is fluorescent microscopy. So that is the thing. Coming on the fifth feature, the next feature on the surface. Now come on the cell membrane. The cell membrane will show multiple blab formation. Blabs are formed. See the diagram. See. Now after nuclear features, the nucleus is pycnotic, the nucleus is fragmented. Now see the cell surface. The cell surface will form the blabs. The cell surface will form multiple blabs, so that now that in the next portion apoptotic bodies are formed. Ultimately we have to form the apoptotic bodies, not the blab formation. So till now what we have read. So this is a normal cell. Everyone see this one is the normal cell. The first one. The first thing is cell shrinkage. We can appreciate cell shrinkage here. Number one. We can appreciate eosinophilia. Because of cell shrinkage, it is eosinophilia. The condensation of the chromatin. That is more pink cytoplasm. That is eosinophilia. The third thing is pycnosis. Condensation of the nucleus. The fourth thing is karyoraxis. The fragmentation of the nucleus. The fifth thing is the blab. Till now the concept is clear to you. Cell shrinkage, eosinophilia, pycnosis, karyoraxis, blabs. Do you have any doubt? Now please appreciate the blabs are formed. The blabs. But during blab formation, still the plasma membrane is intact. The cell membrane is intact. There is no defect in the cell membrane. Blabs are formed, I appreciate, but there is no defect. The plasma membrane is intact. So there is no leakage, no inflammation. ब्लैब्स आर फॉर्म, लेकिन ब्लैब का फॉर्मेशन का मतलब ये नहीं है कि उसमें होल हो गया. ब्लैब बना लेकिन देयर इज नो डिफेक्ट, नो होल, नो गैप. गिव मी अ थम्स अप, गिव मी अ थम्स अप. So that is the fifth point. So you can see the electron microscopy, beautiful diagram. This is a normal cell and this is a apoptotic cell. The apoptotic cell is showing the blabs. Appreciate the blabs. The blabs on the surface of apoptotic cells. You can see the blabs here. Everyone give me a thumbs up. Everyone. So next feature is apoptotic bodies formation. Now the blabs get converted into multiple apoptotic bodies. Each body contain a portion of plasma membrane, a portion of cytoplasm, and a portion of nucleus. The nucleus is also fragmented now. One fragment of nucleus in one apoptotic body. one fragment of the nucleus. So all apoptotic bodies contain nucleus also. They contain small cytoplasm also. They contain small cell membrane also. During this process also there is no leakage. There is no leakage. Give me a thumbs up. So apoptotic bodies are formed. What are apoptotic bodies? These are membrane bound, cell membrane bound masses. These are the multiple round masses which are bound by cell membrane, which contain small amount of eosinophilic cytoplasm and small amount of nuclear debris. They contain cytoplasm also, nuclear debris also. Give me a thumbs up. And the last feature, the seventh one, is phagocytosis. Is phagocytosis. A phagocyte will come and destroy all. Can you see a phagocyte, the green color cell? It is coming and engulfing everything. It is engulfing. So can you enumerate, anyone among you, enumerate the seven, 1, 2, 3, 4, 5, 6, 7, the seven morphological features of apoptosis one by one? Anyone? Okay, I will write it for you. So this one is the normal cell. What is the first feature? The first feature you can see here in this diagram. Sufi, Ankit, write it down. It is cell shrinkage. It is cell shrinkage. The first feature is the cell shrinkage. What is the second feature? The second feature, due to compactness, it is eosinophilia. Eosinophilia is the more pink colored cytoplasm. The third is the nuclear change, that is pycnosis. You can see here. The fourth is the karyorrhexis, right? The fifth is the blab formation. The fifth is the blab formation. You can see here. The sixth one is the okay. Sixth one is the apoptotic bodies formation. And last one is the phagocytosis. A phagocyte is coming and engulfing all. Everyone give me a thumbs up. Everyone. Can you identify them in sequence? Now, okay, I will write it down. The first, second, third, fourth, fifth, sixth, seventh. The seven features. The first is the cell shrinkage. Cell shrinkage. You can imagine. Cell shrinkage. The second is eosinophilia. Very good, Supi. Eosinophilia. After eosinophilia, the two nuclear changes, pycnosis and karyorrhexis. Karyorrhexis, right? Pycnosis and karyorrhexis. Pycnosis and karyorrhexis. After that, what was there? Pycnosis, karyorrhexis के बाद blab formation. After, due to blab, apoptotic bodies formation, and in the end, phagocytosis. Answer two questions. Answer two questions. Anyone want to give two answers? Number one, which is the earliest? Number two, which is the most specific? If someone asks you, the question MCQ is about earliest feature, the answer is cell shrinkage. But if someone is asking you most specific or characteristic feature of apoptosis, so answer is this one, characteristic or most specific. Answer will be pycnosis and karyorrhexis. Everyone give me a thumbs up. I cannot super simplify than this. It is a super simplified pathology. I cannot, no one in this world can super simplify than this. Appreciate my efforts. So that is the morphology of apoptosis. We are done. We are done. We would like to do some polls here. Some polls based on morphology. Yes, Sufi. So some polls based on morphology, you have to participate in the poll and give your answer, right? This is the first question in front of you. This is the first question in front of you. Please, I want everyone to participate, not only few students. What is your answer from ABCD? Read the question. What is the earliest change in apoptosis? The four options are in front of you. Let me see if I can see your chat. Yes, I can see your chat. Yes. Yes. So, Sufi, what is the answer here? Others, what is the answer here? I want everyone to participate. Come on, why only Sufi is participating? So please, at max you will be wrong. Yes, very good. Barun, very good, Barun, very good, Sufi. The earliest change is cell shrinkage, as I have already told you. So the earliest change is cell shrinkage. Very, very good, very good. So cell shrinkage is the answer here. Now the second question, what is the characteristic feature of apoptosis? I'm not asking earliest. I'm asking characteristic feature. I'm asking, read the four option. Read the four option. Cell membrane intact, is it the feature? Cytoplasm become basophilic, is it the feature? The nucleus become molded, is it the feature? Or cell swelling is the feature? What is the answer? What is the answer? Yes, anyone? Anyone? Yes, Barun. Very good, Barun Shah. Very good, very good. So correct answer, no, no, no. It is not B. I'm sorry. What you have said, the answer is B. No, the answer is not B. The answer is A. I got confused. No, Sufi, it is not C. Listen now, listen. What I am saying, listen, listen. It is a tricky question. Everyone listen. You are wrong. Listen. So, cell swelling is not a feature of apoptosis. It is a feature of necrosis. That's why this option is wrong. It is not basophilia which occurs, Barun. It is the eosinophilia which occurs now. Basophilia don't occurs in apoptosis. Eosinophilia occurs in apoptosis. That's why this option is also wrong. Nuclear molding. Sufi, you are saying nuclear molding. Nuclear molding, nahi, nuclear condensation occurs. Nuclear condensation or compactness and fragmentation occurs. It is not molding of nucleus which takes place in apoptosis. So these three options are wrong. They don't take place in apoptosis. What is correct about apoptosis? So only one option is correct. Cell membrane remain intact till end. That's why there is no leakage. That's why there is no inflammation. So that is the characteristic feature that differentiated from necrosis. In necrosis, the cell membrane is not intact. There are defects in the cell membrane. So there is leakage, there is inflammation in necrosis. So this is the feature which differentiated from necrosis, and it is the characteristic feature. Give me a thumbs up, Sophie and Barun. Give me a thumbs up, and others. So at least you people tried. I'm happy that you have tried and you are wrong. Once you have committed your mistake here, now you will not commit in the exam. So whatever mistake you want to commit it here only in the practice. Don't commit it in the exam. So good. Better to be wrong here as compared to be wrong in the exam. Everyone give me a thumbs up. Come on. Everyone. So correct answer here is A. Have you got it? Have you learned it? Have you learned from your mistake? Yes? Give me a thumbs up. Come on. Okay. So correct answer is A. So this is the next question in front of you. Please read the question. All of the following are the features of apoptosis except. The question contains except. Don't miss except. Which is not a feature of apoptosis. Read the four option. Very easy. Read the four option. It is a very easy question. I want everyone to be right here. So all of the following are the features of apoptosis except which is not a feature of apoptosis. You have to tell me that feature. So the four options are in front of you. Cell swelling, nuclear compactness, cell membrane intact, and cytoplasm eosinophilia, which is not a feature of apoptosis. I have told you the seven features, which is not. Yes, Barun, very good. You are right. So correct answer here is A. Cell swelling is not a feature. Cell shrinkage is a feature. So because the question is except, that's why the correct answer is A. It is not a feature. Yes. So nuclear compactness, that is pycnosis, is a feature. Cell membrane intact. Blebs are formed, I agree. But cell membrane is intact. It is a feature. And cytoplasm become eosinophilic because of compactness. Yes, Sufi, you are also right. So correct answer is A because cell swelling is a feature of necrosis, not apoptosis. So correct answer here is A. Have you got it? The next question is in front of you. Can you define apoptotic bodies? What are apoptotic bodies? Can any one of you define apoptotic bodies? What are apoptotic bodies? Are they clumped chromatin bodies? They contains only chromatin material, only chromatin material. Are they pycnotic nucleus without cell organelles? It contains only nucleus, no cell organelles. Or they are cell membrane bound with organelles. They contain cell membrane also and they contain organelles also. Or they have no nucleus only with organelles. What is your answer? Where you will go? What is your answer? Anyone want to participate? What's the correct answer here? Yes, the correct answer here is C. As I have told you, apoptotic bodies, they contain everything. They contain cell membrane also and small amount of all organelles. Small amount of cytoplasm, small amount of nucleus, small amount of everything. Have you got it? Yes, Sufi. The correct answer here is C. Yes, Barun. The correct answer is C. So easy question. Now all these questions which I am launching in polls, these are your previous year questions from NEET PG, FMG, INI-CT. Before INI-CT, we have AIMS, JIPMER, PGI. ये सबके 5 year previous year questions I'm taking here, right? So you should be prepared for your topic. So till now we have done the definition of apoptosis. What is apoptosis? We have seen the two type of apoptosis, the physiological apoptosis, the pathological apoptosis. We have seen the examples of physiological and pathological apoptosis. The most important, we have seen the mechanism of apoptosis in a beautiful super simplified manner. The extrinsic pathway and the intrinsic pathway. In each pathway, the two phases, initiation phase, execution phase, we have completed it. After that, we have seen the morphological change in apoptosis, the 7 changes in sequence, 1, 2, 3, 4, 5, 6, 7. Let me come on the next topic now. Those who have missed, please watch the recording from the beginning. I request you to watch the recording later on. After finishing the lecture from the beginning, you can't afford missing it. You can't afford. Now, the next is diagnosis of apoptosis. How a doctor can diagnose the apoptotic cell. If I give you a slide, this is a slide. You will say, ma'am, you told us 7 features. So this cell is cell shrinkage. It is smaller than other cells. It is more pink. If we see the nucleus, it is pycnotic and it is compactness. So looking at all the features, we can decide that this is the apoptotic cell and rest all are normal cell. Still, I'm confused. Still, if I'm confused, does it have any other way of diagnosing apoptosis apart from morphology? Morphology के 7 features तो हैं. So that is cell shrinkage, eosinophilia, pycnosis, karyorrhexis, bleb formation. These are the 7 features I know. But apart from it, does any other way of diagnosing apoptosis? There are 2 ways. There are 2 ways of diagnosing apoptosis apart from morphology. The first is a marker of apoptosis. In the market, a marker is available. The name of the marker is annexin 5. It is a very important MCQ repeated many times in your exam. It is a apoptotic marker. Now, what is annexin 5? It is a liquid. It comes a brown color liquid in a bottle. It is available in the market. So what you have to do, take your slide. This is your slide now. In this slide, I'm asking you which is apoptotic cell. You are unable to identify. Ma'am, I'm confused whether this one or this one or this one or this one. I'm confused. I can't decide which is apoptotic cell. So you don't have to do anything. Take this marker, annexin 5, and spread it on your slide. Spread it on your slide. Leave it for few minutes. Leave it for few minutes and then wash it out. After few minutes, wash it out. Wash it out. So only apoptotic cell. If this slide, entire slide have any apoptotic cell, whatever apoptotic cell, they all will pick the marker. Others, normal cell will not pick the marker. So after washing, see it under microscope. So apoptotic cell will be of brown color and rest of the cell will be pink color only. Give me a thumbs up if you got it. So that is the annexin 5. That is the role of the annexin 5. Now you should ask me, the student should ask me a question, ma'am, why annexin 5 is binding only with an apoptotic cell and not with normal cell? What is the mechanism? What is the mechanism? Actually, annexin 5 binds with phosphatidylserine. In a normal cell, as I have already told you, that phosphatidylserine is a phospholipid which is present on the inner membrane of the cell membrane, inner surface of the cell membrane. So if you give annexin 5 here, it cannot bind with phosphatidylserine. So it will, this cell do not take the color, do not take the marker. But during apoptosis, as we already know that phosphatidylserine flipped out on the outer surface, there is externalization of phosphatidylserine. So this annexin 5, the marker annexin 5 will bind with it and give color to the apoptotic cell. Give me a thumbs up. So the same diagram from the Robbins. Can you see the cell membrane in the two cells? See, this is the cell membrane, this is the cell membrane. This one is a normal cell, this one is an apoptotic cell, right? In the normal cell, appreciate phosphatidylserine on the inner surface, and in the apoptotic cell, appreciate phosphatidylserine on the outer surface. Appreciate. Now see annexin 5 molecules. Here annexin 5 cannot bind because it is present on inner surface, and here annexin 5 binding with the phosphatidylserine, giving color to this cell. So that's why this cell is colored. Yes, Sufi, the same mechanism, right? So it is annexin 5 reagent which is not binding here and it is binding here. Everyone give me a thumbs up. That is the first way. That is the first way of diagnosis. What is the second way of diagnosis? The second way of diagnosing apoptosis is electrophoresis. In biochemistry, you may have already studied what is electrophoresis. What is electrophoresis? So I'm talking about agarose gel electrophoresis. Agarose gel electrophoresis. What is agarose gel electrophoresis? So in electrophoresis, what do we actually do? So let me draw two cells for you. This is a normal cell. This is the nucleus of the normal cell. This is the apoptotic cell. This is the nucleus of the apoptotic cell. How does the nucleus of the two differ? In the nucleus of the normal cell, the DNA is continuous. It is double-stranded DNA, which is continuous. It is a normal cell. It is a normal cell. But in apoptotic cell, as I have told you, in nucleus, two things are happening. First, pycnosis. What is the second one, Sophie? The second one. What is the second one? Ashutosh, what is the second one? Second one is karyorrhexis, that is nucleus is fragmented. So here DNA, the nucleus is fragmented into multiple pieces. It is not single strand, double stranded DNA. It is not the same strand, the double stranded DNA. It is not in continuity. So see the nucleus of the two type of cell. This is the normal cell. This is the apoptotic cell. Appreciate it. Appreciate it. Who is causing the degradation of the nucleus? The fragmentation of the nucleus. Who is causing? There is an enzyme. The name of the enzyme is endonuclease. Endonuclease enzyme is causing this fragmentation. Have you got it? Now in electrophoresis, what actually we are doing? In the process of agarose gel electrophoresis, we take the nucleus of the two cells out. And from the two cells of the nucleus, we extract the DNA. We extract the DNA and take the DNA on agarose gel. We extract the DNA and take it on agarose gel and see the DNA. So this is the agarose gel electrophoresis. Now see this cell. See this cell, this one, okay. See this cell, the nucleus is continuous. The DNA is continuous. See this cell, the DNA is continuous. Can you see? See this cell, the first one. Can you see this DNA? It is in fragments. It is in fragments. Can you appreciate the fragments? So this cell is the apoptotic cell. This cell and these cells are normal cells. These are non-apoptotic. Give me a thumbs up. Give me a thumbs up. So on agarose gel, we will see the DNA. It is fragmented into multiple pieces. It is fragmented into multiple pieces. It is not in continuous. Now, can you see the arrangement? It is in fragments. So this apoptotic cell, the nucleus on agarose gel, it is looking like a CD, step ladder. You know step ladder, the English word step ladder. हिंदी में कहते हैं इसको सीढ़ी, सीढ़ी चढ़ना. You know, सीढ़ी होती है ना एक के ऊपर एक. So it is looking like step ladder. So this is known as step ladder pattern. So apoptotic cell give step ladder pattern on agarose gel electrophoresis. That is the summary. Everyone give me a thumbs up. Apoptotic cell gives step ladder pattern on agarose gel due to fragmented DNA. Since the DNA is fragmented by an enzyme known as endonuclease. So endonuclease enzyme doing the karyoraxis, fragmenting the DNA. So when we arrange this cell on an agarose gel, the DNA of this cell, so it is giving step ladder arrangement. Give me a thumbs up. So during karyoraxis, the endonuclease activation leads to short DNA fragments. It is not a long DNA fragment. It is divided into small size. The ladder pattern is the characteristic feature for apoptosis. It is not specific but characteristic. Give me a thumbs up. I hope you got it. So what are the two ways of diagnosing apoptosis? What is the summary? First tell me the summary. What are the two ways of diagnosing apoptosis? What are the two ways of diagnosing apoptosis? The first way to diagnose apoptosis is a marker. The name of the marker is annexin 5. And the second way of diagnosing apoptosis is agarose gel electrophoresis. What is the summary? So annexin 5 works or shows its mechanism via phosphatidylserine. Since apoptotic cell have phosphatidylserine on the outer surface, externalization, that's why it marks, it gives color or it does the tagging only of apoptotic cell, not of normal cell. So we can differentiate apoptotic cell from normal cell. In agarose gel electrophoresis, there is a role of an enzyme known as endonuclease, which is activated in apoptotic cell, not in normal cell. So this endonuclease causes DNA fragmentation that is known as karyoraxis, and because of which when we take the DNA on agarose gel of apoptotic cell, it will give step ladder arrangement. The arrangement is step ladder arrangement. That is the summary. Everyone give me a thumbs up. Yes, Sufi. Very good. Everyone. So we would like to do some polls based on diagnosis. Topic by topic, we are doing the polls. Right. So this is the first question in front of you. I want everyone to participate. Step ladder pattern of DNA on electrophoresis in apoptosis is caused by activation of which of the following enzyme? Step ladder pattern का reason क्या है? What is the reason for step ladder pattern? Who will tell me the correct answer? Is it endonuclease? Is it transglutaminase? Is it DNase? Or is it caspase? Which enzyme is giving? Yes, Barun. Yes. Anyone else? Yes, Hemant, Barun, Sufi. Very good. The correct answer here is endonuclease. So endonuclease is the enzyme which is giving step ladder pattern. Correct answer is this. It is a question of NEET PG few years back. We all know that it is a repeat question, repeated many times. Next question. Annexin 5 is a marker of repeated many times. It is a PYQ which is repeated in many exams. So of course, it is a baby question. Everyone knows the answer. Everyone knows the answer. Annexin 5 is a marker of apoptosis. Currently, this question looks super simple to you. You will say, ma'am, it is a very easy question. Everyone knows the answer. It is a baby question. But once you finish all your 19 subjects, all your topics, now the same question will become difficult for you. You will get confused, right? So please learn annexin 5 is a marker of apoptosis. Correct answer here is A. So till now, we have covered the definition of apoptosis. We have done the types of apoptosis, physiological, pathological, with examples. We have done the mechanism of apoptosis, the extrinsic, intrinsic pathway with initiation, execution. The 7 morphological changes in apoptosis in sequence, the earliest change, most characteristic change. We have seen the diagnosis of apoptosis, the 2 ways of diagnosing. That is annexin 5, the marker of apoptosis, and agarose gel electrophoresis. The last topic, the differences from necrosis. I request all the students who have joined late and missed any of these headings starting from the beginning, please watch the recording later on. Let me finish my lecture, and after that, please watch the recording from the beginning. The portion you have missed, you can't afford missing it. You can't means you can't. If you are preparing for any of the medical exam, either your university exam of MBBS for the pathology or any of the competitive exam, NEET PG, FMG, INICT, NEXT, or any other medical entrance exam, you are trying. Apoptosis is such a topic you can't miss. And I am teaching this topic in detail, so you will excel for MCQs also, for theory also. So please watch the recording later on. Okay, let me finish it in the next 5 minutes. How apoptosis differ from necrosis? As I have told you, there are 2 ways of cell death, apoptosis and necrosis. These 2 are the type of cell death. In both of them, the cell is dying. The cell death occurs. What is the differences between them? What is the differences between them? Let me teach you the differences from necrosis. How does it differ from necrosis? So see the basic differences. So apoptosis, necrosis. Apoptosis occurs. Here cell death occurs of a single cell. Here it occurs of a cell in group. So here single cell dies. Here single cell death occurs. Here a group of cell is dying, not a single cell. This is apoptosis. This is necrosis. That is the first difference. Give me a thumbs up. That is the first difference. Please learn it. Number 2, in apoptosis, cell shrinkage occur. Cell shrinkage occur. In necrosis, cell swelling occur. Here the cell is shrinking. Here the cell is swelling. Here single cell is there. Here a group of cell is there. Give me a thumbs up. Give me a thumbs up. Everyone give me a thumbs up. So that is the size of the cell. Now come on the nucleus. The nucleus is same. In apoptosis, it is pycnosis and karyoraxis. In nucleus, there is pycnosis, there is karyoraxis, but there is one more feature, karyolysis. So you can learn the nuclear features are same. Pycnosis, karyoraxis are same in both of them. Nucleus में कोई अंतर नहीं है. That is condensation of nucleus and fragmentation of nucleus takes place in both. The third thing which is excessive additional karyolysis here. Karyolysis is you can say the nucleus will lose the basophilia, losing of basophilia. Nucleus will become pinkish in color. That is additional in necrosis. Otherwise, the two changes are same. Now, let me teach you three things in continuity. In apoptosis, let me draw a cell. In apoptosis, here the cell membrane is intact till end. The blebs are formed. Here the cell membrane converted into blebs. But still the cell membrane is intact, and after bleb formation it converted into apoptotic bodies. But still cell membrane is intact. Here the cell will swell. In necrosis the cell will swell. Because of swelling the cell membrane have defects. So there are defects means holes or defects or gaps in the cell membrane. It is not continuous. That's why here in apoptosis, since cell membrane is intact, there is no leakage of cytoplasm. Here cell membrane is disturbed. There are defects, so leakage of cytoplasm take place. यहाँ पे no leakage, यहाँ पे leakage. Since there is no leakage, no inflammation. Since there is leakage, there is inflammation. Give me a thumbs up. So here cell membrane intact, here cell membrane disrupted. Since cell membrane is intact, cytoplasm, there is no leakage. Since cell membrane is disturbed, cytoplasm leakage is there. There is no inflammation, there is inflammation. Give me a thumbs up, a big thumbs up. So let me tell you the differences between apoptosis and necrosis. You will tell me the differences. You will draw the diagram and tell me the differences. You will draw the diagram. It occurs of a single cell. It occurs of a group of cells. Here the cell shrinkage occurs. Here the cell swelling occurs. See the difference. Cell shrinkage occurs. Cell swelling occurs. You can see, right? Cell shrinkage, cell swelling, right? After that, you can see the cell membrane. You can see the nucleus is same of both of them. Let me write the nucleus. Nucleus is same. So here also pycnosis, karyoraxis. Here also pycnosis, karyoraxis, and one additional karyolysis. Nucleus is almost same. Now let me tell you about the cell membrane. Cell membrane ka kya? Cell membrane ka kya? Here cell membrane is intact till end. Here cell membrane is disrupted. It is disrupted. So there are gaps. There are gaps in that. There are holes in that. So it is defective. So since cell membrane is intact, there is no leakage, no inflammation. And since cell membrane is disrupted, there is leakage, there is inflammation. Everyone gave me a thumbs up. Have you got it? Have you got it? So the same diagram from Robbins. I will show you the two diagrams from Robbins, right? See, this is necrosis and this is apoptosis. See the two diagrams, the two parallel diagrams. Give me a thumbs up. You're not giving the thumbs up. Come on, give me a thumbs up. In the necrosis, can you see a cell? Please appreciate a normal cell here. Please appreciate a normal cell here. The cell is normal. The cell is normal. After that, see the two cells here. This one is swelled and this one is shrink. Now do a back-to-back comparison. This one is shrink. Give me a thumbs up. Am I visible, audible? So let's compare the two cells. Here the cell is swelled and here the cell is shrinked with bleb formation. The blebs are there. Blebs ke saath it is shrinking. Give me a thumbs up. Can you do the comparison? Back-to-back comparison. Here apoptotic bodies are formed. Here apoptotic bodies are formed. Multiple apoptotic bodies are formed. Apoptosis is taking place. But here apoptotic bodies are not formed. If you can appreciate, the cell membrane is disrupted. Can you see? There are defects in the cell membrane. The complete cell membrane is disrupted. Due to the disruption, there is leakage. Because of the leakage, please appreciate these are the neutrophils which are coming and causing inflammation. So inflammation is present because cell membrane is disrupted, leakage is there and inflammation is there, right? But here a phagocyte is coming. This is the phagocyte. Neutrophil is not coming and phagocyte is engulfing all the apoptotic bodies. So no disruption, no leakage, no inflammation. Everyone gave me a thumbs up. Have you got it? So the same diagram you can see. So I am done with the topic. In the last, I would like to launch few polls. You have to answer it. I want everyone to participate. This is the first question. This is the first question based on differences between apoptosis and necrosis. Okay, I will read the question. You tell me what is the answer. What is the common change which occur in both apoptosis and necrosis? Which is common in both? Which occurs in both? Tell me among the four options which occurs in both. In apoptosis also and necrosis also. What occurs in both? What occurs in both? Read the four options. What is occurring in both? Barun, Sufi. Tell me what is the correct answer. Hemant. Anyone else? Ashutosh. Anyone else want to tell me the correct answer? Yes, what takes place in both? What is common? Both. For both. Let me see your chat. Just a second. Okay, I can see your chat. Yes, Barun, you are right. Cell shrinkage occurs in apoptosis. Bleb formation also occurs in apoptosis. Presence of inflammation occurs only in necrosis, not in apoptosis. But chromatin condensation, that is pycnosis, is a feature of both apoptosis and necrosis. Very good. So yes, I would like to go with C. And you all are right. Sophie, Barun, you are right. The correct answer is C. Okay. This is the next question in front of you. Apoptosis is different from necrosis by presence of what? By presence of which of the following feature? So tell me a feature among the four options which is present in apoptosis but not in necrosis. Tell me a feature which is present in apoptosis but not in necrosis. Which of the following is a feature of apoptosis? In short, the examiner is asking which of the following is a feature of apoptosis. Apoptosis में क्या होता है? Easy question with a difficult language. So absence of inflammation, it is there in apoptosis or necrosis? Yes, absence of inflammation is in apoptosis. Cell swelling, it is in necrosis. Disruption of the cell membrane, it is in necrosis. And passive process, necrosis is a passive process. I have told you apoptosis is the active process and necrosis is a passive process. So which among the following is present in apoptosis but not in necrosis? The correct answer is A. So absence of inflammation is seen in apoptosis but not in necrosis. Yes, yes, Sufi. The correct answer here is A. So don't get confused in the language. The correct answer is A, right? So done. I guess I am done. I am done with the topic. Now the next topic is necrosis, which I will take in the next lecture. So thank you very much for being with me. Here I would like to end now for this topic. There are few announcements for you people about the next lecture and few more announcements. Let me do the announcements. Thank you very much for being with me. I really enjoyed teaching you. Hopefully same from your side. If you like the lecture, don't forget to click on the like button before you leave the lecture. Please click on the like button. It is useful for me. Don't forget to drop a comment in the comment box. Your feedback in the comment box. It's really important for me, right? Please share the link of the class and also of the YouTube channel to all your friends, colleagues, everyone. Subscribe the YouTube channel and press the bell icon for the notification if you have not done. The name of the YouTube channel is Let's Crack NEET PG of Unacademy, right? And you can download, you can install the Unacademy app. On the Unacademy Learners app, you can download the notes also, right? So please do all these things if you like it. Now Unacademy is offering few new offerings on the Plus subscription. So if you take the subscription of Unacademy, these are the few additional features apart from lectures you will get. You will get all previous year questions available on the app for practice of the students. So NEET PG, FMG and INICT, all previous year question bank with answers with detailed explanation is given to you on the app. Once you take the subscription, it will be available to you. Exclusive doubt clarification batch we are launching from the next month, 6th of April, next month. So there is a batch in which you can ask anything. You can ask anything means anything. You can ask anything. So it's up to you. Whatever is your doubt, you can ask anything. There is a practice test after every plus class. So after every plus class, we will give you a bunch of 5 to 10 MCQs to practice that. So these are the new features added. So previous year question is added from 23rd March. Doubt clarification series is about to come. Ask anything. Ask me anything. So of all the 19 subjects, you can ask anything to your favorite educator. And daily practice papers after every plus class, 5 to 10 MCQs, right? This is the NEET PG free calendar for the March. So on 29th, 30, 31st, every day we have a free test. I request you to take participation in these tests. For participating in these tests, the test is free. You require a code. The code is Sachdev10. SACHDEV. Sachdev10 is the code. Please participate in the test by using this code. It is a free test. The only thing you require a code, right? Unacademy is launching test series also. That is known as Unacademy Lite. That is test series that contains more than 450 practice tests, subject wise, system wise, full length, previous year, test series by the top educator. You get everything there. So you can practice, practice, practice. Now, the biggest announcement is that for the last 3 days of the year, for the month of March, 28th March till 31st, instead of 10% discount, you will get 20% discount on Plus as well as Iconic subscription. So today and tomorrow is the last day of this offer. So I request all the dear students to if you want to take the subscription, take it now. This is the biggest sale. You will not get this sale again, right? So you can see the various plan, 2 months, 6 months, 9 months. There are various plans are available. In Plus, this is the old price and this is the new price. In Iconic, this is the old price, this is the new price. Compare the price. Compare the price. So instead of 10% discount, you are getting 20% discount. Only thing you will require a code. The code is my surname, the same code, Sachdev10. SACHDEV. Sachdev10 is the code. So please apply this code on any of this plan, you will get 20% discount. And help me in distributing the code on your batch group, seniors, juniors, or all the medicos throughout the globe, so that everyone, those who want to get subscription, they get on discount. That is the thing. We are launching MBBS Prof 1 for the preparation of the university exam as well as next on Unacademy. On Unacademy, we have two type of subscription. The plus subscription, in which you will get only Unacademy live and recorded lectures. In Iconic, along with Unacademy, you will get Prep Ladder also. Once you take the subscription, you will be eligible for all these batches by the topmost educators of the India. Thank you for being with me. Let me announce my next lecture. So from 10 to 12, I'm having a plus class right now. Right now, from 10 to 12 for the next 2 hours, I'm having a plus class. So those who are the subscribers, they can come and join the plus class. I'm going to teach you hemodynamics and pathology there, right? After 12, I'm having a free class. So from 12:15 to 1:15 today in the afternoon, I'm having a free class, a free special class that is not on YouTube, that is on Unacademy app. So those who are the newcomers, please install Unacademy app, Learners app, and watch my free special class there. Use code Sachdev10 to enter in the free class. The class is free, you will require a code. Please use this code to enter in the free class. I am going to teach you pharmacology there. So I teach pharmacology in a wonderful way. In pharma, I'm going to teach you antimicrobial drugs there. So don't forget to join me at 12:15. Everyone, those who are watching right now. So please at 12:15, make an alarm and please join me on the app. Thank you. See you. Bye-bye. Study hard. I'm ending this lecture.